Sulphonamide is a folate synthesis inhibitor and has bacteriostatic effect. It has a wide spectrum of antimicrobial activity and it is widely used in urinary tract infection and prophylaxis purpose. Sulphonamide is effective against both gram-positive, gram-negative bacteria and enterobacteriaceae like E. coli, Proteus, Enterobacter and Klebsiella. However, Pseudomonas and Serratia are resistant to sulphonamide. It is also effective for Nocardia, Chlamydia species, and Toxoplasma gondii. The structure of sulphonamide is chemically alike with PABA. It is a competitive inhibitor and it will compete with PABA to bind with the enzyme DHPS. When sulphonamide is inserted into the active site, the production of dihydrofolic acid is terminated, and the DNA and RNA of the bacteria cannot replicate. Sulphonamide is usually taken orally. It can be divided into short, intermediate, and long half-life. Sulphonamide are distributed throughout the whole body and even pass through placenta. It will cause toxicity to the fetal tissue, so the pregnant woman must not take sulphonamide. It is mainly metabolized in the liver through glucuronidation. The metabolite may precipitate and cause crystalluria. The excretion of sulphonamide is mainly through the glomerulus filtration. Most of the sulphonamides are available in the form of tablet and injections. As we mentioned before, sulphonamide is metabolized in liver and secreted through kidneys. That's why for the patient who takes sulphonamide, we have to carry out hematology tests as it will cause folate deficiency anemia. Besides that, we have to carry out liver function tests as sulphonamide is metabolized in livers. If the liver is malfunctions, it will cause toxicity to the patients. Next, we have to look into the aspect of creatinine clearance in the patients, as all the sulphonamide is secreted through kidneys and some causes renal toxicity. For the adverse effect of sulphonamide, it will cause disturbance of urinary tract, aplastic anemia, hypersensitivity, and acute hemolytic anemia.
Fluoroquinolones. It is a synthetic antibacterial agent. Foreign atom is attached to position 6 of quinolone. It is a broad-spectrum antibiotic which is active against gram-positive such as Streptococcus pneumonia, gram-negative Salmonella typhi, and miscellaneous bacterial infection such as Chlamydia pneumonia. Fluoroquinolones are used to treat urinary tract infections, lower respiratory tract infections, intra-abdominal infections, chronic bronchitis, and community-acquired pneumonia. There are two mechanisms of action, mainly targeting to inhibit the DNA synthesis of bacteria. Fluoroquinolones target on DNA gyrase and topoisomerase 4. For gram-negative bacteria, DNA gyrase will be significantly targeted. Fluoroquinolones will bind to DNA gyrase and DNA, form a ternary complex, causing the positively supercoil cannot be relaxed. Thus, DNA replications cannot be proceeded. For gram-positive bacteria, topoisomerase 4 will be significantly targeted, thus prevent the replicated DNA to separate into daftar DNA. There are mainly two dosage forms of fluoroquinolones, which are oral administrations and parenteral administration. Fluoroquinolones are well absorbed in gastrointestinal tract. Fluoroquinolones are also extensively distributed in bodily fluids. Fluoroquinolones are mainly excreted by glomerular filtrations and active tubular secretions in the kidney, abscess moxifloxacin which is excreted through liver. Fluoroquinolones are incompatible with theophylline. They obstruct the elimination of theophylline.
Created using Powtoon.